On November 18, 1904, an associate professor of surgery from Johns Hopkins University delivered a now famous address to the Academy of Medicine in Cleveland. Entitled The Special Field of Neurological Surgery, this was written by Dr. Harvey Cushing. Cushing, ever the torchbearer, leads the way. The history of Chicago neurosurgery starts in 1877 with a 40-year-old Danish physician and surgeon, Dr. Christian Fenger. Fondly referred to as the Osler of the Midwest, Dr. Fenger is responsible for successfully introducing antiseptic surgery to Chicago.
Fenger was European trained, and he was a pathologist and a surgeon, and he also stimulated a group of internists and stimulated a whole group of surgeons.
Fenger achieved a number of notable neurosurgical firsts, including drainage of an intracerebral abscess, trapping of a traumatic vertebral artery aneurysm, and resection of an intramedullary tumor. In the early 1900s, two notable general surgeons, Alan B. Kanavel at Northwestern and Fenger-trained Dean DeWitt Lewis at Rush Medical College, started to operate on the brain, spinal, and peripheral nerves. Kanavel was one of the founders of the American College of Surgeons in Chicago and went on to become the chair of surgery at Northwestern and president of the American College of Surgeons. Amongst Kanavel's many accomplishments in neurosurgical firsts include development of the infranasal transsphenoidal approach to the pituitary in 1909 and the transoral approach to the C1-2 junction in 1917. Dean Lewis received his medical degree from Rush Medical College and was an intern at Cook County Hospital. Subsequently, he returned to Rush, where he was known as an inspiring teacher of surgical anatomy and clinical surgery. Between 1925 and 1934, Chicago witnessed the arrival of the first formally trained neurosurgeons. These luminaries include Dr. Loyal Davis. Davis received his MD at Northwestern, performed his internship at Cook County Hospital. He was a student of Kanavel's and was sent to train with Cushing for 10 months.
Late 25, early 1926, the first trained neurological surgeon in Chicago was Loyal Davis.
As such, he was the first formally trained neurological surgeon and the first to limit his practice to only this specialty. He built the Northwestern program starting in 1925.
Now, Loyal Davis was a neurosurgeon across the street, and he was famous for being strict, to say the least. He would tell his residents, stop sweating, or stop shifting weight, or I can replace you with a 5-cent postage stamp.
Percival Bailey, a Southern Illinois native, received his medical degree from Northwestern and his PhD at the University of Chicago. From 1918 to 1928, he trained with Harvey Cushing at the Brigham Hospital. There, he and Cushing developed the histological classification of brain tumors that is still in use today.
So I remember a meeting of the Chicago Neurological Society when a New York neurosurgeon came with the 2 boxes of slides, 2 projectors, and talked about oligodendroglioma. And the moderator, I don't remember who it was, it could have been Dr. Oscar Sugar, spotted Dr. Bailey in the back of the audience and said, Dr. Bailey, what do you think about it? And Dr. Bailey said, oh, that's all hogwash. And they say, why do you say this, Dr. Bailey? He said, I should know, I invented them.
In 1928, Percival Bailey, who had really never been trained as a neurosurgeon, was Cushing's neuropathologist, was hired by the U of C. He resigned in 1939. Well, that was fortunate for the NPI because he called Dr. Oldberg, who was in the process of setting up the NPI, and immediately hired him.
Percival Bailey trained several influential neurosurgeons, including Paul Bucy, Bill Sweet, James Watts, and Earl Walker. Eric Oldberg, a native of Evanston, Illinois, he obtained his medical degree from Northwestern, where he was a student of Drs. Kanavel and Davis. His claim to fame is that he was the last Cushing resident. From 1932 to 1971, he was chief of neurology and neurosurgery at the University of Illinois at Chicago.
He was the last full-time resident of Harvey Cushing. After that, Cushing took 2 or 3 at a time. Say he saw the opportunity with the NPI and developed it, and it was a really major source of neurological research.
Here we have the Big Five of Chicago neurosurgery. The special field of neurosurgery, as described by Cushing, had finally come to fruition. However, we're not quite finished. Chicago has other luminaries beyond the Big Five. Paul Bucy of Kluver-Bucy fame was a student of Bailey's. He was a prominent member of the AANS and helped to organize the American Board of Neurological Surgery. He was influential both at the University of Chicago and Northwestern University.
He was a man of small stature. He was short, but of huge presence. He had the steely blue-gray eyes that looked you straight in the eyes when he talked. He had a booming voice, but very mellifluous diction.
This was a true giant in neurosurgery. The Journal of Neurosurgery was in his office, and I think up until that time, all of the boards in neurosurgery were given here in Chicago.
Agnes Marshall-Walker had an accomplished career, including being a co-founder of the American Association of Neuroscience Nurses. Dr. Anthony Raimondi created the specialty of pediatric neurosurgery. He founded its governing structure, the International Society for Pediatric Neurosurgery. Several of his pupils went on to become chairmen of departments of pediatric neurosurgery throughout the world.
Well, Dr. Raimondi developed an amazing program. He had a residency staff that he picked. He established a pediatric neurosurgical unit.
The Irishman, Dr. Sean Mullan, arrived at the University of Chicago in 1955. During his distinguished career, he was known as a surgical innovator in the treatment of cerebrovascular disease and pain relief procedures. Dr. Roy Bakay was a pioneer and leading surgical authority on Parkinson's disease. Throughout his 40-year career, he was at the forefront of stereotactic surgery for movement disorders. Chicago neurosurgery is in great hands. The Big Five neurosurgeons were trained by founders of their specialties and became true pioneers themselves, with legacies that reach around the world. Neurosurgery leading the way. Hold tight, everyone. We are on a demanding course, an amazing journey. And peering out, we recognize those broad shoulders, the explorers, the inventors, the envelope pushers. We too endeavor to make a lasting contribution to the storied history and Cushing's special field of neurological surgery.